day everyone, today I will be explaining about hysteroscopic polypectomy. This is a minimally invasive procedure used to remove endometrial polyps. Endometrial polyps are abnormal growths in the lining of the uterus. Most of these polyps are benign, but in rare cases, they can be malignant. Etiology of hysteroscopic polypectomy. The development of endometrial polyps is mainly related to hormonal factors. One of the main causes is excess estrogen, which leads to hormonal imbalance. It is also commonly seen in women during perimenopause and postmenopause. Additionally, conditions like endometrial hyperplasia can increase the risk. Verification checklist. Before performing the procedure, several important checks must be done. The doctor will review the patient's medical history and overall health status. There are also some contraindications to consider, such as pregnancy and pelvic infection. Statistics of surgery. In terms of outcome, studies show that 63.8% of patients experience improvement in symptoms. However, about 14.2% may have recurrence of polyps. A total of 170 patients achieved pregnancy after the procedure, with 110 occurring spontaneously. Complications are relatively low, with only 8 report cases, including 2 major complications. In conclusion, hysteroscopic polypectomy is a safe and effective procedure with good outcomes and low complication rates. Thank you.
Hello everyone, today I will briefly explain assessment, investigation and specific pre-operative care. Assessment is carried out to review the patient's overall status before the procedure. For investigation, diagnostic hysteroscopy is the gold standard as enable direct visualization, as well as biopsy and removal if needed. Endometrial biopsy is performed to identify hyperplasia, malignancy, or infection. Blood tests, including FBC and coagulation profile, are used to evaluate anemia, infection, and bleeding risk. For specific pre-operative care, physical preparation included obtaining informed consent, establishing IV access, and cervical priming. Physiological preparation involved anesthesia evaluation, fasting for 6 to 8 hours for solids and 2 to 4 hours for fluids, and bowel preparation when necessary. Emotional support includes giving reassurance, providing clear information about the procedure, and explaining recovery and possible complication. That's all for me. Thank you.
Hello everyone. Today I will present about operating room preparation. First, check the OR schedule to know the type of surgery, timing, and required equipment. Next, early room preparation is important to ensure all instruments and equipment are ready, clean, and arranged properly. Then, personal hygiene must be maintained by wearing clean attire and avoiding accessories to reduce infection risk. Lastly, hand hygiene and wearing a surgical cap are essential to maintain a sterile environment. In conclusion, proper preparation helps ensure patient safety and smooth surgical procedures. Now, I will present about the preparation of instruments. First, the hysteroscope, either rigid or flexible, must be checked to ensure it is clean and functioning properly. Next, the light source and fiber optic cable are prepared to provide clear visualization during the procedure. Then, the camera system and monitor must be set up to display the internal view clearly for the surgeon. We also prepare the distension medium system, such as normal saline or glycine, to expand the uterine cavity for better visibility. In addition, the fluid management system is important to control the inflow and outflow of fluids during the procedure. Last but not least, hysteroscopic scissors are prepared for cutting or removing tissue when needed. In conclusion, proper instrument preparation ensures the procedure runs safely and effectively. That's all from me. Thank you.
Hello everyone.
Now I will be explaining the steps involved from positioning until intraoperative consideration for hysteroscopic polypectomy. First, the patient is placed in the lithotomy position to allow proper exposure of the surgical area. We ensure the patient is comfortable and positioned correctly to prevent nerve injury. Sterile drapes are then applied to expose only the surgical site while maintaining a strict sterile field. Next, safety protocols are carried out, which include sign-in, time-out, and sign-out. During sign-in, we verify the patient identity, procedure, and consent. Time-out is performed to confirm the correct site, surgical team, and safety readiness. Finally, sign-out ensures all procedure details, specimens, and counts are correct. Surgical counts is also performed before, during, and after the procedure. This includes counting all instruments, needles, and sponges to prevent any retained surgical items. For the procedure, a hysteroscope is used to provide direct visualization inside the uterus together with specialized instrument to safely remove the polyps. This procedure uses a minimally invasive hysteroscopic technique with continuous uterine distension to maintain clear visualization throughout the surgery. During the operation, the team is responsible for maintaining sterility, monitoring the patient's condition, and assisting the surgeon effectively. In addition, understanding the anatomy of the uterus and endometrium is important to avoid damage to surrounding tissues. Lastly, strict aseptic technique must always be followed to prevent infection and contamination, ensuring patient safety throughout the procedure.
Post-operative care is the care given to patient after surgery. Its main goal to stabilize the patient and ensure a safe recovery. First, emotional support is important. Patient may feel fear or anxiety, so we need to reassure them that these feelings are normal. We should also give clear information about their recovery to reduce stress and help them understand what to expect. Creating a calm and comfortable environment also helps patients feel safe and recovery faster. Next is pain management. We must regularly assess pain levels and monitor vital signs to ensure safe treatment. Pain medication should be given on time before the pain becomes severe. We also use a combination of methods, including medication and non-drug technique like proper positioning and relaxation to manage pain effectively. In conclusion, post-operative care focuses on emotional support and pain management to ensure a smooth and safe recovery. Thank you.
That's all from us. Thank you for watching.
See you next time. Bye.
Dah lalang. Kasih. Okay, scuba.
Janganlah rekod.
Ada dekat luar, ada kemuncak.